Angeles, Chicago, Houston, Phoenix, Philadelphia, and San Antonio were all ill with a disease for which there is no cure. Just imagine the 23.6 million Americans that reside in these cities were all sick. Well, did you know, according to the American Diabetes Association, 23.6 million people have diabetes. That's a staggering 8% of our population. And even more astonishing, the American Diabetes Association estimates that 400 million people will have it by 2030. Given the statistics, this disease is bound to affect you either directly or someone you care about. Therefore, today I want to discuss the physical differences between type 1 and type 2 diabetes, the warning signs, the health problems that result from this disease. Type 1 diabetes is mostly found in children. Usually 1 in every 400 children have type 1 diabetes. It is not the result of a person's lifestyle and cannot be reversed by changing your lifestyle. Whether you are thin, fat, or unfit is irrelevant. Exercise and eating healthy can help control it but cannot make it go away. Type 1 diabetes is an autoimmune disease, which means it destroys the cells in your pancreas that produce insulin. The prognosis is either insulin injections or a pump. Type 2 diabetes is usually in people over 35 with obesity or lack of exercise. Genetics also play a big role. Type 2, you are not making enough insulin, and what is being produced is not being used correctly. Type 2 can sometimes be controlled with diet and exercise, but usually you have to take oral medication, insulin injections, or wear a pump. The warning signs of both are both similar. Some increased thirst, extreme hunger, frequent urination, weight loss that has no explanation, weakness, body fatigue, and blurry vision, and irritability. Symptoms are similar, but the way they are diagnosed is not. Type 1 is brought on suddenly within a few months. Type 2 is usually a more drawn-out process, which usually requires a doctor with a routine exam with a blood test. There is a long list of health issues with either type: risk of high blood pressure, toe and foot and leg infections that require amputations, kidney failure, tooth and gum disease, and a lot of nerve damage. Adults have a 2 to 4 times higher risk of heart disease and stroke. Today there is 23.6 million people with either type 1 or type 2 diabetes. Understanding the disease, its warning signs, and health problems is key to a diabetic living a long and happy life. My diagnosis of type 1 came at the age of 10. I still think of the days before the tests and the scheduled test and the worries. I am supported by my family and friends, and I am inspired by the friendship of people like me who make this journey.